Everything you need to know about high blood pressure. Hi all. Video 2, High Blood Pressure, Diagnosing, How to Understand, Treatment Options, Medication. 4. Diagnosing high blood pressure. Diagnosing hypertension is as simple as taking a blood pressure reading. Most doctors' offices check blood pressure as part of a routine visit. If you don't receive a blood pressure reading at your next appointment, request one. If your blood pressure is elevated, your doctor may request you have more readings over the course of a few days or weeks. A hypertension diagnosis is rarely given after just one reading. Your doctor needs to see evidence of a sustained problem. That's because your environment can contribute to increased blood pressure, such as the stress you may feel by being at the doctor's office. Also, blood pressure levels change throughout the day. If your blood pressure remains high, your doctor will likely conduct more tests to rule out underlying conditions. These tests can include A. Urine test. B. Cholesterol screening and other blood tests. C. Test of your heart's electrical activity with an electrocardiogram (EKG), sometimes referred to as an ECG. D. Ultrasound of your heart or kidneys. These tests can help your doctor identify any secondary issues causing your elevated blood pressure. They can also look at the effects high blood pressure may have had on your organs. During this time, your doctor may begin treating your hypertension. Early treatment may reduce your risk of lasting damage. 5. How to understand high blood pressure readings. 5.1. Two numbers create a blood pressure reading. A. Systolic pressure. This is the first, or top, number. It indicates the pressure in your arteries when your heart beats and pumps out blood. B. Diastolic pressure. This is the second, or bottom, number. It's the reading of the pressure in your arteries between beats of your heart. 5.2. 5 categories define blood pressure readings for adults. A. Healthy. A healthy blood pressure reading is less than 120/80ths of a millimeter of mercury (mmHg). B. Elevated. The systolic number is between 120 and 129 mm Hg, and the diastolic number is less than 80 mm Hg. Doctors usually don't treat elevated blood pressure with medication. Instead, your doctor may encourage lifestyle changes to help lower your numbers. C. Stage 1 hypertension. The systolic number is between 130 and 139 mm Hg, or the diastolic number is between 80 and 89 mm Hg. D. Stage 2 hypertension. The systolic number is 140 mm Hg or higher, or the diastolic number is 90 mm Hg or higher. E. Hypertensive crisis. The systolic number is over 180 mm Hg, or the diastolic number is over 120 mm Hg. Blood pressure in this range requires urgent medical attention. If any symptoms such as chest pain, headache, shortness of breath, or visual changes occur when blood pressure is this high, medical care in the emergency room is needed. A blood pressure reading is taken with a pressure cuff. For an accurate reading, it's important you have a cuff that fits. An ill-fitting cuff may deliver inaccurate readings. Blood pressure readings are different for children and teenagers. Ask your child's doctor for the healthy ranges for your child if you're asked to monitor their blood pressure. 6. Treatment options for high blood pressure. A number of factors help your doctor determine the best treatment option for you. These factors include which type of hypertension you have and what causes have been identified. 6.1 Primary hypertension treatment options. If your doctor diagnoses you with primary hypertension, lifestyle changes may help reduce your high blood pressure. If lifestyle changes alone aren't enough, or if they stop being effective, your doctor may prescribe medication. 6.2 Secondary hypertension treatment options. If your doctor discovers an underlying issue causing your hypertension, treatment will focus on that other condition. For example, if a medicine you've started taking is causing increased blood pressure, your doctor will try other medicines that don't have this side effect. Sometimes, hypertension is persistent despite treatment for the underlying cause. In this case, your doctor may work with you to develop lifestyle changes and prescribe medications to help reduce your blood pressure. Treatment plans for hypertension often evolve. What worked at first may become less useful over time. Your doctor will continue to work with you to refine your treatment. 7. Medication for high blood pressure. Many people go through a trial and error phase with blood pressure medications. You may need to try different medicines until you find one or a combination of medications that work for you. Some of the medications used to treat hypertension include A. Beta blockers. Beta blockers make your heart beat slower and with less force. This reduces the amount of blood pumped through your arteries with each beat, which lowers blood pressure. It also blocks certain hormones in your body that can raise your blood pressure. B. Diuretics. High sodium levels and excess fluid in your body can increase blood pressure. Diuretics, also called water pills, help your kidneys remove excess sodium from your body. As the sodium leaves, extra fluid in your bloodstream moves into your urine, which helps lower your blood pressure. C. ACE inhibitors. Angiotensin is a chemical that causes blood vessels and artery walls to tighten and narrow. ACE, angiotensin converting enzyme, inhibitors prevent the body from producing as much of this chemical. This helps blood vessels relax and reduces blood pressure. D. Angiotensin II receptor blockers (ARBs). While ACE inhibitors aim to stop the creation of angiotensin, ARBs block angiotensin from binding with receptors. Without the chemical, blood vessels won't tighten. That helps relax vessels and lower blood pressure. E. Calcium channel blockers. These medications block some of the calcium from entering the cardiac muscles of your heart. This leads to less forceful heartbeats and a lower blood pressure. These medicines also work in the blood vessels, causing them to relax and further lowering blood pressure. F. Alpha-2 agonists. This type of medication changes the nerve impulses that cause blood vessels to tighten. This helps blood vessels to relax, which reduces blood pressure. End video 2. Thank you for watching. Please watch the third video with the following content: high blood pressure, home remedies, dietary recommendations during pregnancy. Train hard, eat right, and enjoy life. Doctor of your life. If you find it helpful, please like, comment, share, and subscribe. You will see the next videos.